troubleshooting and irrigation maintenance of a nasogastric tube. It's the next day. I've come on to see my patient. I notice his tube is not draining very well, and he also is a little distended, feels a little bloated. He could be nauseous if the tube weren't working properly. So I need to assess what's going on. So I'm going to turn off my suction. I'm going to assess my patient, again, listening for bowel sounds. And I also want to check if the tube, verify the tube placement. Is it where I left it? Okay. So I hopefully would have charted where that was, or the person who inserted it should have charted at what centimeter mark they did the insertion. Okay. All right. So I would get here and I look at my tube and I'm going, yeah, okay. Yeah, and so it's at the mark. But remember, the tape could still be here, but the tube could have slid in and out. So always check your mark, okay? So that's okay. I also want to inspect the skin around the nose, make sure there's no area of evidence of redness or breakdown. So that part looks okay. I could also look inside, if I were concerned, I could look inside my patient's mouth to see if the tube is coiled up in the back of the throat. If I had trouble seeing it, I might use a tongue blade to hold the tongue down to look back there. But no, I can see the tube running straight down from the back of the throat all the way back behind the tongue and all the way on down. And one straight piece, no coiling, no loops of tubing there. All right. So my suction hasn't been draining, so I'm going to go ahead and troubleshoot, and that's going to be the irrigation. I am not including the part about talking to the patient. That is already in the ATI video. I'm just wanting to give you the DIY part that goes along with it. All right, so I'm going to irrigate. I've used my normal saline. Remember, if it's an open tube, it needs to be labeled, dated, date, time, and your initials. It's only good for 24 hours because this is something that's opened intermittently. All right, I'm going to pour my saline in. Be sure it's saline, not sterile water, not hydrogen peroxide. Okay. And I want to go ahead. Now, if there were any question about the placement of my tube, the patient had been vomiting, then I would either have to go back and verify my placement or pull back and reinsert the tube. Okay. And so hopefully that doesn't happen. So we are going to go ahead now to irrigate the tube. So I had turned off my suction. I'm going to go ahead and disconnect it. And I'm going to pinch my tube so that I don't make a mess with it. And I'm going to put, I'm going to just set this over here for now so I don't lose my little connector. All right. So I'm going to put my syringe in the hole. I'm going to make sure it's secure, and I'm going to, you can irrigate 30 to 60 mils. You could work it up and down a little bit and see if it would go in. Seems like it's going in easily. You might see if you get stomach contents back. I'm getting a little bit of liquid back, not much. I could do it a second time. Discarding what I had, if I had pulled away, I could discard that in a basin. Okay. The last thing, so I want to go ahead and reconnect after I've irrigated it to my suction. Now this would not be performed on anybody who had stitches in their stomach. Okay, stitches in the stomach means you need to talk to the surgeon because those stitches could be ripped or torn, disrupted, and we don't want that happening. Okay, so I'm going to go ahead and resecure this and turn my suction back on. Okay. Now I would want to come back in about 30 minutes and see if that indeed had worked. One other thing that I really need to do for my, anytime you open this system, anytime it's been hooked to suction, and then I open the system like this, and then reconnect it. Once I reconnect it, I need to put air in the pigtail. Remember I said blue air, only air in the pigtail, okay? So we're going to inject the air into the pigtail. And that's just to reestablish the proper sequence the way it's supposed to clear. All right.